everybody. Welcome, welcome, welcome. We are back tonight with our actually fourth lesson related to medical English. Today, we're going to have a split class. We're going to be talking half about patient and doctor communication and half about writing prescriptions and medication management. So if you've never been to one of these before, hello, my name is Ariella and I am the CEO and founder of the American Institute. We are an English school and cultural center based in Algiers. I am an English teacher and I have been teaching English for over a decade, and I've been living in Algiers now for almost 6 years. And I do these classes as a partnership with the US Embassy Algiers, where we offer free online English programming to students from Algeria or around the world. So this is the course that we are in the middle of right now. This is medical English. So you can see that we have already done the first 3 sessions, and now we are on session 4, prescription writing and medication management. After tonight, we'll have 2 more lessons: vocabulary for mental health and patient care, and a last course on really about medical research. So how to approach conferences and events in the medical field. The course is free. It is online, as you can see, and it is every Sunday night from 6:30 to 8. And we are recording the class right now and publishing it on our YouTube channel for anyone who misses parts of it or wants to rewatch it later. You're more than welcome to. The class is open to everyone, but as you can hear, I'm speaking English at a rather quick pace, and so it is targeted for upper intermediate English speakers or higher. We have a few course rules, so we ask that you stay appropriate in the chat because I will invite you to chat with me. Actually, I just realized I think I forgot to turn the chat on. All right, I just turned the chat on. If you can do me a favor and say hi, it will let me know that it's working. So please send me a hi or a hello. Oh, good. I see we have someone with us saying hello, hi. A few folks. Good, happy to have you here. All right, so this is the chat that you will use to engage with me in the course and to engage with each other, because even though these are webinars, which means that I'm the only face you see, the only voice you hear, there are attendees or students in this virtual classroom, and I like to ask you questions, engage with you, and I really rely on you and your participation to make this an interesting class for everyone. I ask that you stay on topic. While you are in this class, let's talk about what we are here to talk about, which today is medical English, and that you participate actively. So this is the only course where I have this little disclaimer that I put at the beginning, which I always smile at because it's so obvious to me that I am not a medical professional, but maybe to others, they think that I'm a doctor from the US or something, but I am not. I'm an English teacher. I'm a trained teacher. So even though we're teaching medical English, there may be questions that you have. What is this tool called, or what is this illness called, that I might not know the answer to, because if it's not sort of general English level knowledge, if it's really specialist knowledge, I might have to myself consult Google. So the goal of the course is really to introduce medical terminology to you, the kind of terminology that a native fluent English speaker will know and use, as well as some more technical language that, again, are familiar but technical. So if we have doctors in the room with us, please do not hesitate to correct me if I say something that's not accurate, that's incorrect. All participation is welcome. I also have to give another disclaimer because I'm starting to hear some noise in the background, which is that I have a puppy, and my puppy likes to join into my webinars, and she's very quiet when I'm sitting alone with her. And as soon as I start a webinar, she decides it's time to play with her toys. Can you hear her? She's suddenly making a lot of noise in the background. Well, no one's saying anything, so maybe you can't hear her, but that's my second disclaimer. So number 1, I'm not a medical professional. Number 2, my dog might make some noise, and I apologize. So before we jump into prescriptions and medication management, I wanted to finish what we had talked about in our last webinar, which was a lot about communication. So we talked about different types of communication in the medical field, whether it's between a doctor and another doctor, between a doctor and sort of a family member or someone who's related to the patient, and then of course between a doctor and a patient. We didn't get a lot of chance to actually put into use the communication tips. And so I have here some scenarios, and I'm hoping that you can help me in figuring out what is the appropriate way for a doctor to speak to a patient. So we'll start directly with that. And once we finish the end of this module, we'll go into prescriptions. So here we have a doctor, I suppose a doctor or a nurse, you can't tell just from the outfit, and a patient. So a quick review, some of this we went over last time, but a quick review before we get to our scenarios. In sort of gold standard patient-doctor communication, we're going to need an introduction. Hello, I'm Dr. So-and-so, perhaps me, I'm Dr. Knight, that's my last name, and I'll be conducting your physical exam today. So we can say, how are you feeling today? We can say, how are we feeling today, which is kind of an informal or funny way to ask the same thing, how are you feeling? And what brings you in today? Again, I know we talked about this, so this is just a review. And then explaining procedures. So especially in the United States, where informed consent is extremely important. I mean, it's important everywhere, but I think in the US, there have been some high profile cases, or there's been attention to medical consent. So before a doctor performs a procedure on a patient, they are obliged to explain the procedure. So this person or this doctor in the first example is saying, I'm going to perform a physical examination to check your overall health. All right, so even before they touch your face, for example, if sometimes they want to feel along your jaw to feel your muscles, they will tell you before they start touching you what they're about to do and what's the intention of it. Okay, so I see the example continues here. This will involve examining different parts of your body to ensure everything is functioning properly. All right, so that's sort of a basic explanation of a doctor to a patient. Then we're talking now about symptoms. So we're imagining that a patient has arrived at a doctor's office and they are not feeling well. So some of these questions that a doctor might use could be, when did you first notice these symptoms? On a scale of 1 to 10, how would you rate your pain? Which my students in previous classes have told me that the Algerian pain scale, that there is a pain scale also used in Algeria. I'm not sure if you were in my last class when we talked about it, but if you're here with me tonight, is this true? Do Algerian doctors ask you to rate your pain on a scale of 1 to 10? Is there some sort of scale that they'll use when they're talking to you about your pain, the level of your symptoms, the level of discomfort? I want to know, tell me in the chat, have you ever had a pain scale? One person said it's not a pain scale, it's an emoji. So you point to a smiling emoji or you point to an unhappy emoji and you sort of pick the emoji that matches your pain. Have you ever had this in Algeria? My very loud dog. Now sneezing. I see no, I see EVA. Is this an acronym, EVA? Okay, Radia says we use the scale. So Radia, you must yourself be maybe a professional, or maybe you mean we as in Algerians. And then most people are saying, no, I don't remember a doctor asking me that. Batia, what is EVA? What does that stand for, the acronym? I'm curious. I'm sure it's probably a French acronym. But yeah, maybe that will help us figure out if it's similar to the 1 out of 10 pain scale. All right, while you are sending me that answer, I hope you're sending me that answer, we'll continue. So now here's our first scenario. So you have a new patient who seems very nervous. I know that on the slide I said, come on the microphone, but since we're just getting started, I'd like you to write, what would you say to a patient who seems really nervous? You are the doctor in this scenario. what would you say to a patient who seems nervous? You don't have to send me a big paragraph of text. Just send me one thing that you would say to make someone feel less nervous. Okay, Badia says in French, EVA is échelle, so scale, visuel, okay, visual scale, analogique. Okay, I would say maybe a visual body scale. So yeah, it sounds similar to the rate you're paying out of numbers 1 through 10. Okay, I'm going to give you a minute. I'm patiently waiting, and I'd like to see what you recommend a doctor could say to a new patient who seems nervous, maybe before they start any examination. What kinds of things could they say? Oops, I went to the next slide by accident. I might add an idea of my own while you're thinking. A new patient. Maybe they'll say something like this, like, don't worry, I'll tell you everything before we get started. So sometimes new patients are very nervous about getting a shot, or they're unfamiliar with procedures. Maybe the procedures are somewhat revealing. They have to take off some clothing and they feel uncomfortable. So I would recommend that a doctor says to a new nervous patient, hey, don't worry, I will tell you before we get started. I had another one. I had another idea. What can a doctor say to a patient who seems nervous? Something along the lines. Iman, just take a breath. Yeah, very nice. Just take a breath, just breathe. Don't worry. I will ask your permission. So this is similar to my first example, which is about sort of, sometimes I think when patients are nervous, it's because they feel like maybe they'll be out of control. They won't be allowed to say no if something hurts them. So I think it's good to say, I will ask your permission. Tanina says, relax, it's fine, we'll deal with the problem. Yeah, nice. Okay, beautiful. So let's look at some phrases, common phrases that can reassure patients during exams. So general reassurance, we have you're doing great. This is happening. Actually, let me do it as a quiz. When is this happening? When, if you imagine someone is getting an exam from a doctor, do they say this before the exam, during the exam, or after the exam? The doctor says to the patient, you're doing great. Tell me in the chat. During, before, during, or after the exam? I have during, I have after, I have during. And Selma's sending me a really nice phrase a doctor could say to a nervous patient. Don't worry, you're fine. I'll explain to you all the procedures. Great. During. Okay, awesome. So you're doing great is during the exam. This is what you say to a patient when they're in the middle of the exam. And often we say this when the patient is doing something uncomfortable or painful. So I'm trying to think of something. I don't know if you've ever had an eye exam where they have to hold your eye open and they blow air directly at your eye, or there's another one where they shine a really bright light and you have to keep your eye looking at it. So it's uncomfortable and it's painful. Well, maybe it's more uncomfortable than painful, but either way, it doesn't feel good. And so the doctor, after they've started the procedure, so maybe they've done one eye, but they haven't moved to the next eye, they can reassure the patient and say, you're doing great, okay? Which is a way of encouraging the patient to stay relaxed. Everything's fine, even though it was difficult to hold your eye open, you did it well. It's a way of making sure that they're still comfortable and ready to continue. I have some good sentences coming in for reassurance from the doctor. You are in great health. Okay, I mean, that's reassuring if they are in fact in great health, definitely. And then relax, everything is going to be all right. Okay, I like that. Everything looks good so far. Everything looks good so far. What does it mean to say so far? Does it mean it's before, during, or after the exam? Imagining we're still doing an exam. Everything looks good so far. Is it before, during, or after? Okay, I have after, I have during, after, after, after. Well, this one's a little bit of a trick question because I will say that typically you hear this phrase after an exam is finished. But the reason I will still accept during is because usually you say this when someone has more exams in the future. So imagine you go to a doctor, you complain of headaches, and they do a CT scan. They check to see what's happening in your head. So then when the doctor is looking at the results, maybe she says, well, everything looks good so far, but I'd like to get a second scan because this part of it is not a very clear image. Okay. So it's a way of saying that your process is not finished. When we say so far, we indicate that there's more steps coming. But usually everything looks good also means some of the evaluation has already been done. So I accept both answers during and after. And yeah, during and after. I accept both. I was going to add more details, but I think that's good. This won't take long. Before, during, or after the exam. This won't take long. Okay, I have before. Another before. Okay, we have a universal before. Nobody has a different opinion? Well, you are correct to the befores. This won't take long. This is what we say to someone before, but usually right before. So it's not a day before. It's not a week before. It is the moment that someone is maybe you want to do an EKG where you listen to someone's you put the what are they called, electronodes, to listen to someone's cardiac rhythm. So they're lying down. I'm in the middle of lying down on the table. I'm really just about to begin. That's when the doctor will say, this won't take long. So it's before, but I prefer also Josefine's answer at the beginning because I can see why Farida you're saying before and during because it asks the question, well, what is before? If you're already lying on the table, isn't that during? So I accept both. And then I'll be as gentle as possible. I'll be as gentle as possible. So I think this one can maybe is obvious, but I'll ask the same question again before, during, or after the exam. Would the doctor say this? For, during, before also, right before starting. Mhm. Yeah, the reason I said I think this one might be obvious is because it's basically the same as the previous one. It's the before, but in a very immediate sense. With future tense, I will, we know that it's something coming in the future. And by context, this phrase is something that always comes in the immediate future. Good. During potentially uncomfortable procedures, this is the type of phrase you might hear from a doctor. You might feel a little pressure, but it shouldn't be painful. Can someone imagine an exam that this could be speaking about? What exam is it that you could feel a little pressure, but it shouldn't feel painful? A little pressure, but not painful. What types of medical exams have a little pressure but not pain. Well, and it certainly doesn't say not painful. It says it shouldn't be. Yeah, Lubna says dentist. That's what I think about also. I always think about the dentist. But I think this probably applies to other scenarios. So for the dentist, I can think of two different things. I can think of your regular cleaning when they're sort of checking your teeth to see how solid they are and they push really hard and you feel pressure, but it's not particularly painful. Or if you have a cavity at the dentist and they need to do some drilling, they will give you anesthesia. So it blocks the pain, local anesthesia. So you're still awake, but you're able to feel the pressure without the pain. Okay. Next, this part might feel a little bit cold, but it will be over quickly. This part might feel a little bit cold, but it will be over quickly. Injection after local anesthesia. Injection after, yeah, exactly. That's right. That's the example I gave for the dentist. Injection after you have local anesthesia. Good. Who can give me an example about this one? This part might feel a little bit cold, but it will be over quickly. What is something that would make sense for this? Has anyone here ever had a medical procedure where the equipment is really cold? And dentist also. Now everyone's thinking about the dentist. I have to say, I'm thinking about my example of EKG. Oh, stethoscope. Yeah, stethoscope. So when they're listening to your lungs and your heart. Yeah, great. I was thinking about the EKG. I don't know if you've ever had an EKG, but when they put the nodes, they put them kind of all over your chest area near your heart. And it has a gel and it's quite cold. So it's cold, but it's over quickly because they put it on you and then you sort of lie there and wait and there's no pain and it doesn't stay cold because once it's on your body, it heats up. And gel, that's right, gel for a sonograph. That's absolutely, I think the same as the EKG. It's like anytime they're using a gel on you, it feels cold and sort of sometimes a little icky. And if you need a break at any time, just let me know. So that's something that can happen where definitely the procedure is painful. I know we're trying to find examples that are not the dentist, but I have had many cavities filled in my mouth. I've had many procedures with the dentist, and this one I definitely can relate to, especially because when they're working in your teeth, your mouth is open. So it can hurt your jaw to have your mouth open for so long. And that's why they'll say, all right, tell me if you need a break when you need to sit up and, sort of massage and close your mouth a little bit. So these are some phrases you'll see during uncomfortable procedures. This part actually is really interesting, which is explaining the reason for requests is extremely relevant when you're talking about doctor and patient communication. Instead of simply telling someone, can you lie down, or can you, lift your shirt up, or can you, giving an instruction, explain the why, and you will automatically improve your communication with your patient. I can tell you that as a patient. So here's an example. Could you please sit up straight for me so that I can listen to your lungs clearly? Thank you. So you explain the why when you give the instruction. All right, we have a few more before we get to our scenarios. Okay, good. We're almost at our scenarios and then we'll get to prescriptions. So here are a few more phrases. So we've gone over general reassurance. We went over introductions actually first, and then general reassurance, and then phrases to say in a uncomfortable situation. So here are phrases that a doctor can say that encourage communication from the patient, that encourage response, sharing, that you, especially when you rely on the patient to tell me when something hurts, this is the kind of language that you can use. So please tell me if you feel any discomfort. Let me know if you need me to stop or if something doesn't feel right. And don't hesitate to tell me if you're feeling uncomfortable. All of these are synonyms. They're exactly the same level of language, the same level of kindness. So it's really just 3 ways to say the same thing. All right, so here's our scenario. I think we're going to stay on chat. Let's stay on chat for now instead of trying to go to microphone. Maybe we'll do the microphone later. So the scenario is you need to take someone's blood. Do you know what it's called when we take someone's blood in English? There's a specific phrase we use. I'm going to give a minute to the chat to see if you can guess it. The phrase we use to take someone's blood. Okay, I see blood sample. I accept it, yes. Blood sample, we would say maybe, yeah, to give a blood sample. Selma, blood draw. Thank you. That's what I have in mind, which is a blood draw. I'll put it in the singular. So a blood draw is what it sounds like, which is to take someone's blood. You may say to me, Ariella, a blood draw doesn't sound like taking because drawing is to take your pencil and to make a beautiful picture. But actually the verb to draw has 2 different meanings. To be honest, it actually has more than 2 different meanings, but we'll talk about the most common. So to draw, which is to draw, design a picture with markers and colored pencils and things like this. And then also to draw something out, it means to pull. I draw blood, means I pull blood from your body. We can also use draw in the sense of taking information from someone who doesn't want to give it. So maybe we have a friend or a sibling who's very secretive. They don't like to share. And so we draw out details from that person, by asking them question after question after question until they finally start to give us more details. So these are the meanings around draw blood is similar to draw out information. Badia is giving me another definition of draw. Yeah, draw has so many meanings. To draw a card, absolutely. To draw a card is a little bit similar to draw blood. I mean, it's not a perfect match, but you have the same image of pulling something. Because to draw a card is you go to the deck of cards and you pull one away, similar to drawing blood where you're pulling blood out, or draw out information. I'm pulling it away. Okay. Okay, so now that we've gone over the scenario, you need to take someone's blood, draw their blood. You need to draw their blood. How would you say it? How would you ask? Or how would you inform? I'm going to wait for some sentences in the chat for me, please. How would you say it? Oops. Okay. Can I take a blood draw from you? Can I take a blood draw, please? We will have to draw some blood from your body. Okay. We're going to use, in these cases, we're going to use the verb perform to perform a blood draw. Or simply to draw blood. Great. Yeah, I think these answers are good. I would recommend some language around, like, let's say, politeness. Do you mind? Are you ready? I'd like to draw your blood now. Are you comfortable? I'll put that in there. Blood now. Are you comfortable? And this is also assuming, are you comfortable? Good. This is also assuming that the person has been notified, right? Because usually the person drawing your blood is not your doctor. And so the patient already knows that they're having a blood draw that day, and they're just waiting for gosh, who's the one who draws blood? It's not a technician. It's a nurse. I suppose they're waiting for the nurse to come and draw their blood. Or the reason I'm thinking of a technician is I'm thinking of external labs. Yeah, and sometimes we call these lab technicians. Let's see if we want to do any more scenarios before we go to prescription. Maybe just, no, I think we should go. Gloria is telling me that the person who draws your blood is a phlebotomist. I got nothing. I have no idea. Yeah, it's definitely not a term that you would hear if you were outside of the medical establishment. All right, we're gonna move ahead because I believe we did these in our last presentation. All right, so we'll jump to this. Essentially, as I wrap up this module on communication tips between doctors and patients, I want to make it very clear that there's no perfect way, and there's no one way for a doctor and a patient to communicate, or for a doctor to communicate with his or her patients. But I hope that you took from these exercises some vocabulary ideas of typical sentence, typical phrases that you can use in these scenarios, and that ultimately communication, whether it's medical or business or personal, it really just depends on the person in front of you. And so your job, if you're the doctor, is to modify your communication based on the patient in front of you. Just as it's my job to modify my communication to match the students in front of me. Okay. And then of course, practicing active listening. We hear a lot of stories about doctors who are super busy, in a rush, and don't always have the time to fully sit and take the 20 minutes, the 30, the 40 minutes to talk to a patient and figure out what is going on at the end of the day. All right, so we are, yeah, good. We're 30, 40 minutes in, and we're going to now move to the next module. So this is all about prescriptions and medication management. Before we move forward, I just would love to know if there is someone here who is a pharmacist or who has studied pharmacology. Please tell me in the chat. Say, you can raise your hand or you can say me. I'm really curious because I had a lot of fun preparing these presentation slides. I really enjoyed the topics, and I just want to know if I have any pharmacists in the chat or in the room with me tonight. If that's not you, you can sit silently and I'll give 30 seconds. And if I don't hear from anyone, I'll assume that we don't have pharmacists with us this evening, but maybe some who will watch the presentation on YouTube after. And regardless, information about prescriptions is relevant for all people who may travel the world and need to speak with a pharmacist about medication in English. Well, I have a silent chat, so I think we don't have a resident pharmacist with us. No problem. Let us continue. Let's talk prescription and medication management. I would like to know if we have, what kind of doctors do you think are involved in writing prescriptions and managing medication? What doctors are involved in this process? Ah, Lupna, you are a pharmacist or a pharmacology student. Great, happy to have you here. I was saying to myself, medical English, when have I had a medical English class that I haven't at least had one pharmacist or pharmacology student, because it's a really popular degree in Algeria. So I'm happy. Okay, Lubna, you're a pharmacist. Happy to have you here. So please, you have to correct me if I say anything wrong, and maybe you can help answer some of these questions. So first, please send in the chat what types of doctors are involved when we're talking about prescriptions and medication. What types of doctors? Or I should say, what types of medical professionals? Please send me in the chat. Dentists, medical doctors, okay. Tell me what else? Psychiatrists. Yeah, definitely. Definitely. Any other ideas? Cardiologists. Okay. Okay. Let's go and see what we have. So I see you sending specific doctors, which is wonderful. But in general, when we're talking about prescriptions and medication, the first type of doctor we're thinking about are going to be pharmacists. These are trained and licensed medical professionals who are in charge of managing medication and not fulfilling, filling prescriptions that doctors write. Then you have your primary care doctors. And so, I mean, of course, I wrote primary care doctors thinking about those who you see regularly, who, if let's say you have an infection, you go to your doctor, they give you a prescription. But now that I see you sending specialists in the chat, I would say it's not only primary care doctors, it's any doctor. All doctors have the ability to write a prescription for you. It's just most common that you would get a prescription from your primary care doctor. Then we have community or home care nurses. And my question for you is, oops, oh, my question come up. What do these nurses do? What is a community or a home care nurse? And just guess, if you've never heard of this, just guess, what do you think they do? And how are they different than a hospital nurse? Okay, why do we have a different name for this type of nurse? What do you think these nurses do? A community nurse. Okay, nurses at home. Thank you, Zaki. Good. Anything else? Post-operation care. Okay. They help old people. Yes, they do. They take care of elderly people. They work in the same home of the patient. Great. They draw blood. They help patients. Great. Amazing. Thank you for the answers. So when we're talking about a community nurse, also called a home care nurse, you are absolutely correct. They work inside the home of patients, and they tend to work on more than just technical medical care. So a lot of them, because they're going to work in patients' homes, you will find them in the homes of people who are too vulnerable to come to the hospital. So a lot of that is the elderly people who their immune systems are compromised. It's not a good idea for them to go into a clinic. So instead, they have a nurse come to their home. So it means that the community nurses have contact with areas of the population that are maybe not very visible otherwise, or don't have a large voice. And so the nurses who come to the house end up being a really powerful connector to share with the rest of the medical community. Hey, there's a lot of health problems happening with elderly patients at home, and we need to have a better system to reach out to them. And some of them aren't getting their medication on time, and I want to make sure that we change our procedures. And they end up becoming a voice for those patients. And so that's why you can say that community nurses tend to work not only in medical care, but also in advocacy and health education. And you won't only find them with the elderly, you'll also find them working with the disabled. So individuals who have mild to strong disabilities, but who need regular medical care, and potentially folks who have mental illnesses. Anyone who's suffering from a mental illness that also needs a certain level of care that wouldn't be great or wouldn't be a high quality if they were going into the hospital. They're often generalists, so they can do a little bit of everything, and they usually work alone. So it's one man or one woman traveling to a patient's house. Now, if you compare this with a hospital nurse is usually working on a team and they usually specialize. So it's the nurses for the obstetrics floor, the floor where babies are born. So those nurses have a specialty in delivering babies, just the same way that the nurses in the emergency department have a specialty dealing with emergencies. Community nurses are the opposite. So the opposite of a specialist is called a generalist, and that's what you'll find in a community nurse. So if we go back to my slide here, these are the types of doctors that are involved in medication management and prescriptions. So pharmacists, of course, because these are the ones who quite literally fill the bottle, right? They take the prescription from the doctor, they put the pills in the bottle, they bring it back. But also pharmacists are more than that, because they advise patients, they ask them questions, they do a lot of education. Maybe the doctor was the one who wrote the prescription, but the pharmacist is the one who will make sure the patient understands the potential side effects, understands why they need to take it at certain times of day, why they need to take it on an empty stomach or right after they wake up. So that sort of patient contact and advocacy is very important with pharmacists. Then you have your primary care doctors, which we spoke about, the ones who write the prescriptions. And lastly, these community nurses, and especially when working with the elderly, the community nurses, a lot of them are going every day to their patients' homes simply to give medication, knowing which medication is on Monday, which is on Tuesday, which is on Wednesday. So all of these players are involved in one patient's medication management. All right, let's go to the next slide. So we're going to talk now about pharmacy and medication vocabulary. First, we have the type of language that we use when we talk about medication. We have to fill a prescription, to fill a prescription. I've already said it earlier, and I made a joke because I said quite literally, the pharmacist fills, because I'm talking now about a pill bottle. And imagine me holding a bottle here. The pharmacist fills by putting things in the bottle. But the phrase to fill a prescription is actually quite abstract, because it's you're not filling the prescription itself. The prescription is just simply the order of what that client, or sorry, what that patient should receive. So you could say that its best synonym is probably to complete a prescription. Here's an example of how we use this. I filled the antibiotics prescription that my doctor gave me. Okay, I filled the prescription. So that's the patient talking. It's not just a pharmacist who can say I filled. I filled the prescription implies as a patient that I got it filled. I went to the pharmacy, I got it filled. But you'll hear both the person who did the filling, the pharmacist, and the person who requested the filling will use it the same. We will both say, yeah, I got my prescription filled. Next, to write a prescription. Before I give you the example, does anyone have any guesses? What does it mean to write a prescription? Tell me in the chat. To write a prescription. To fill a prescription is to see what the doctor has ordered and to give that to the patient. What does it mean to write a prescription? Any guesses? Okay, Selma says doctors. Yeah, doctors write prescriptions. Who's seen my doctor wrote me a prescription? Great. Ordering medication. Okay, thank you, Iman. Anything else? So here's an example sentence. The dermatologist wrote her a prescription for medical grade sunscreen. The dermatologist wrote her a prescription for medical grade sunscreen. So to write a prescription is basically to create it, because the way that prescriptions are created is through writing. So you can ask a doctor, hey, can you write me a prescription for painkillers? My head really hurts. So the verb that we use with prescriptions is to write, not to give, not to make, but to write. In my example, you see that I say medical grade sunscreen. So this, in case you're curious, this is for people like me who have very pale skin and burn in the sun. So sunscreen is the cream that you put on your skin that's usually super white and it kind of takes a long time to rub in and it prevents sunburns. Oh yes, and Hisham, I see you asking about this. Prevents sunburns. When we say something is medical grade, so in my example, I say medical grade sunscreen. Medical grade means stronger and too strong, oops, to purchase without a prescription. Medical grade. So that's why I'm smiling a little bit because only someone who burns really badly in the sun, like myself, would ever need a medical grade sunscreen because there's plenty of good sunscreens that you buy regularly in the store with no prescription. So that is my example on to write a prescription. To take your meds. What does it mean? Take your meds. Tell me in the chat. To take your meds. Okay, we have a few different answers coming in. Hisham says 1 in the morning, 1 at night. Someone says to eat your meds. Claudia says your medications. Salah says to take treatment. Good guesses. You seem to literally take your meds in time. Okay. It is quite literal. It's not a very abstract phrase at all. Here's the example I have. He hated taking his meds. They had such bad side effects and made him nauseous. Nauseous. What does it mean, nauseous? They had such bad side effects and made him nauseous. Yeah. Claudia wants to vomit. Thank you. Nauseous means you feel like you need to vomit. You're like, ooh. Some people feel nauseous in the car, driving on many turns and turns. They go, oh, I feel nauseous. I think I'm going to throw up. Nauseous. Yeah. Thank you for the question, Nora Huda. Meds equals medicine. Exactly. Well, you can say meds equals medicine or medication. So medicine and medication in this instance are interchangeable. And taking your meds simply means, I was about to say taking your medication, but I can't use the word taking again. So I would say, using, we'll go with using your medicine, using your medication. So take your meds, you know, let's look at this one. He hated taking his meds because they make him nauseous. Maybe he has some kind of medication for his heart, but to keep a good rhythm, but when he takes it, the side effect is nausea. So he hates taking his meds. He hates using or having, there we go, that's better than using. He hates having his medicine. I think that's it. Okay, so you can see that we have 3, what I'm showing you here is the types of verbs that we use with these nouns. So we take our meds, we write prescriptions, and we fill prescriptions. All right, now I have a game for you. I don't know if you're ready to play it. Oops. Okay, I'm going to show you after I explain. So I have now a matching game. So I have 4 terms or words. I think most are words. Some maybe have 2 words that are related to pharmacology. So being a pharmacist, prescription meds, or purchasing medication. So I have 4. And then I have 4 definitions, but they're not in the same order. So you're matching the term with the definition. And it's not going to be perfect because I can't, give you a piece of paper where you draw a line, which is typically how these exercises are done in an English classroom. But you can still tell me in the chat, like, hey, number 2 goes with number 3. Number 1 goes with number 4, okay, because we have 2 lists. So let's see how fast you can get it. 724, go ahead. We have some fast readers. I have 1 with 2, I have 1 with 4, I have 1 with 3. I have a lot of different answers for 1. I have 3 with 3. I have 1 with 2. So far, it looks like the only thing everyone agrees on is 3, 3. I'm getting a lot of 4, 1. Oh, that's right, because there's a 1, 4 and a 4, 1. Okay, yes. Okay, so I'm seeing 4, 1. I'm seeing 2, 4, 2, 4. Okay, Hussein's just giving it straight in the writing. Let's keep going. Give me your answers if you didn't give me your answers yet. Okay, 4, 1, 2, 4, 2, 2, 2, 4. 1, 2, 3, 3, 2, 4, 4, 1. I feel like we're speaking in like Morse code right now, 4, 1, over and out. All right, great. So, topical. Number 1 on the left. Topical means applied directly to the body. So number 1 is with number 2. I'm sorry for all of those who thought number 1 went with number 4. So topical, just so you know, has 2 different meanings. In the medical sense, topical is about applying something. So sunscreen is a topical cream because you put it on your body directly. However, there's another meaning that's not at all related to medical English. When you say something is topical, you mean that you're saying that something is current. It's related to current day. So you could say, oh, talking about elections, that's topical because there's going to be elections soon in Algeria and in France, for example. So bringing up a topic that's current or makes a lot of sense because of current events. But in medical English, topical just means the way you take the medicine is through the skin, applying right on your body. Beautiful. Number 2, over the counter. Over the counter is going to connect with 4, available for purchase without a prescription. So over the counter, you can see it has dashes between. This is an adjective. So we'll say it's an over-the-counter medicine. It's an over-the-counter sunscreen. We can describe how we purchase something. Oh, I bought it over the counter. Here. I'm going to give you these examples. It's an over-the-counter medication. I bought this sunscreen over the counter. So these are the 2 uses that you will see for it. The opposite is essentially medication that you need a prescription for. So you can ask someone if they are using something like maybe the sunscreen. You can say, oh, wow, where did you get your sunscreen? They go, oh, no, this is not over-the-counter sunscreen. I had a prescription for this. Okay. Great, side effects. So this one I think is the one that you got the easiest, possibly because of my hint in the last example. So side effects are secondary, typically undesirable, bad effects of a drug. We never say, well, I was gonna say we never say it was a good side effect, but okay, it's possible when we want to be funny. We'd say a side effect of taking the medication is I'm sleepy all the time, which is Great for my schedule. I sleep early now every night. So we can kind of like spin side effects to be something positive. But at the base, we're talking about negative side effects. Number 4, we have orally. So something that we take orally is something we take through the mouth. So we swallow it, we eat it. Sometimes we put a pill in the mouth and we let it dissolve. I don't know if you've had any of those before, but so all of those are oral medications because they go through the mouth. Thank you for playing with me. 5 minutes and we're done. Good job. I have another question. In fact, I have a series of questions. This is my first one. What do we call something that removes pain in English? Oh, Hussein, you're so fast. Yep. Very good, Yusra. Radia, good. Awesome. Well, I'm open to other answers. Okay, analgesic. So there is a technical word for painkillers that I didn't include because I've never heard it. Analgesics. Maybe this is a word between doctors. But if you're ever speaking with your patients, we are going to talk about painkillers. A painkiller, and it is one word painkiller. I'm putting on the slide now 2 of the most common painkillers in the United States because we reference these. We're referencing the brand of a painkiller, but sometimes we forget that it's a brand. We think that this is a word where the definition of the word is something that removes pain. And then we have to remember, no. This doesn't mean painkiller. This is just a type of painkiller. So those are aspirin, which you can see on the left, and Advil, which you can see on the right. Those are not the only painkillers. There are more. I was debating adding one called Motrin, which is another popular painkiller in the US. Paracetamol, which is not something, it's funny. Oh, Tylenol. I should have put Tylenol. Tylenol is very common. Paracetamol is the active ingredient of Tylenol, but in the US we call it Tylenol. The reason I thought it would be interesting to add these for you was because when you're watching television or TV shows based out of the US, you'll hear, very rarely you'll hear painkiller, and more likely you'll hear someone say, oh, my head is killing me. Does anyone have any Advil? Does anyone have any Advil? And then someone might say, well, I have aspirin. And they'll go, okay, great. So it's rare. It's much more common that we use the name of the medication than painkiller. Next, this is a 2-part question. What are and why are we worried about super bugs? And if you have no idea of the answer, don't worry, it's coming. Just sit quietly and wait. Super bugs. And you know that this is a course on medical English, so you know that we're not talking about actual bugs. So what do you think I could mean by super bugs? I'll give 30 seconds, and if nobody knows the answer, that's fine. I'm ready to tell you all about superbugs. But in case you know what they are, I'll leave it up for a second. What are and why are we worried about superbugs? Okay, Zaki started in the right direction. He's saying bacteria. Bacteria is the right direction. Insect is not the right direction. It's about bacteria. It sounds like it would be about insects. But actually, something I should clarify is that we actually call illnesses in the US bugs. I caught the bug going around. It means I caught the flu or I caught the cold. So we call illnesses bugs. Yeah, I didn't even think I should have started with that to make this very clear. So illnesses are called bugs. I wouldn't say it's slang. It's very normal language. It's not maybe it's slightly informal, but it's not new. It's not inappropriate. Yeah, I would just say it's an informal way of saying illness. I caught the bug going around. This is a classic sort of, 2 parents talking to each other, little kids spread their germs, they give each other illnesses. And so maybe in the class, everyone is getting sick. So we'd say there's a bug going around the class. And then the parent says to the other parent, oh, I just got sick. I caught the bug going around. And it's really funny because it takes me a while to even remember that bug is the same for insects as for getting sick, because it's so different in my mind, different contexts. Okay, back to superbugs. So Zaki and I think Yusra, you're on the right path here, which is that superbugs are antibiotic resistant bacteria. So nowadays we have antibiotics and we give them out to basically anybody. And not only humans, we're also giving antibiotics to animals because we want them to, we want our cows to get big and grow, mature all the way to full size so that we can eat them for their meat. And so we're giving a lot of our animals antibiotics, and we as humans are taking antibiotics. And so what has been happening lately is that bacteria strains are evolving, and we are seeing more and more antibiotic resistant bacteria. So something that normally antibiotics would cure becomes quickly very dangerous. An example of this is maybe urinary tract infections. So in English, we call this UTI, urinary tract infection. I'll put this. This is a good this is a good one to know, because if you don't know the full name, you may miss it if someone says, oh, I had a UTI last week. So it's an infection of your urinary tract, and it is treated with antibiotics. And these infections used to be incredibly dangerous before antibiotics, but now those facing this diagnosis, they don't even worry for a second. Oh, antibiotics, it'll be gone in a week. And so now we're seeing more and more antibiotic resistant bacteria. And so we're worried about it, the second part of my question, because this poses a big risk to global health, because diseases that we consider no problem, not a big deal, will start to become much, much more dangerous. Okay. Away from that depressing one on superbugs. Yusra adds, let's see what you've added here, Yusra. It's worrying because bacteria evolves to resist antibiotics, and we're running out of effective antibiotics. Yep. It's like a game of, we call this sometimes a game of cat and mouse. It's an expression, and it means each one evolves. So as we come up with a medication, the bacteria learns how to fight it. So we get a new medication, so then it learns how to fight that. So it's like the cat and the mouse. The cat learns where the mouse is hiding, so it starts showing up there. So the mouse changes where it goes, and you're always chasing each other, and there's never a full victory. All right, my next question. What is a drug patent? A drug patent. I'm saying it clearly for the sake of the class, patent, but in my American accent, if I were to say this naturally, I would actually say patent. What is a drug patent? But I know that that's hard to hear the end of the word in my accent. All right, Selma starts us off. Certificate, okay. Power, legal, okay. Legal is good, we're getting somewhere. What is a drug patent? I see maybe brevet is the French. I don't know how you say this in French. So I'm looking for someone to explain it in English. What is a drug patent? Okay, so it says the time it takes to be officially used in the human. Okay, you're on the right track when it comes to things like timeline, development of drugs, how long until we can actually use new drugs in sort of non-test situations. So a patent, this is the legal right for the inventor of a drug to be the only manufacturer and seller of that drug. So it's a little bit like saying they have exclusivity. So one company develops a drug and they get nervous because they want to make money with the drug. But if they develop it and someone takes it home, they break it open, they study it, they can just do the same drug, they can copy them. So a drug patent says, no, 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 no copying allowed. The company that made the drug is the only one who can sell it, is the only one who can make that drug. So it actually has nothing to do about drugs with prescriptions, drugs with doctors. It's just about this protection. The first person who makes a drug is the only one allowed to sell it, at least for a set period of time. So why are there drug patents? Why does this exist that we protect the people who are making new medication? So the logic is that if someone spends 5 or 10 or 20 years developing medication, they put a lot of money into the project. They invest time, they invest resources, they hire a team, they have to go through the approval process. So it takes years and years and years to get a new drug approved. And if that were the case, that as soon as the drug enters the market, people can just copy it. People who put no investment in, who didn't do anything, but they immediately copy the drug and they start selling it at a cheaper price. So it's not worth it logically for the company. Why would they put all that time in if someone else will benefit from their work? So the logic of the drug patent is it will encourage investment in the development of new drugs because it serves as a financial incentive for the pharmaceutical companies. Now, patents exist everywhere in the world. It's like saying trademark. Like trademark, we trademark the name McDonald's, we trademark the name Starbucks. So that's a little bit what we're saying with patent. And every country has a place to register patents. I want you to guess, how long do you think the patent exists? Knowing that it's an exclusivity, it's not forever, okay? How long do you think it is that a patent exists? Is it 1 year? Is it 100 years? Is it 500 years? Tell me. I want you to just send me your best guess. I'm really curious. Okay, Zakia, I have 99 years. Yusra, I have 20 years. Lubna, 20. Hisham, 120. Anyone else? Let's get in here. Give me your best guess. There's no right or wrong answer. I'm just curious to see. 20 from Iman. And Huda 10, Hussein 15. Ferial says 20 years. In 5 years, we call CPP, I think. I don't know what CPP means, Ferial. Amina's saying, I don't understand. What is a patent? So let me try and explain again, Amina. It's a little bit complicated, but a patent is the exclusivity of a drug. So if you have a company that develops a drug, so let's say, not paracetamol, because paracetamol exists, but let's imagine there's another painkiller similar to paracetamol. And my company, American Institute, spends years and years and years making this new drug. So a patent is a protection from the government that says it is illegal for anyone except Ariella to sell this drug because she's the one who put all the work into making it. So she's the only one who gets to sell it. So it's a legal protection. And if I hear that someone else is selling the drug, I can call the police and say they're breaking the law because I have the patent. Only I can sell the drug. But it doesn't exist forever. It's not something that says for the rest of eternity, you're the only one who can sell the drug. It says we will let you be the only seller. We will protect that, the right to exclusivity for a number of years. All right. I have 100 years. I have 10 years. Ferdiel is telling me the CPP is a reward for the time we consumed during the preparation or the process of the patent. Oh, interesting. So they will add more years depending on how long you spent preparing. Okay, cool. Selma, 20 years. Well, nice to end on 20 years because that's basically the average. However, patent protection is different in different countries, but on average, a company has 20 years to protect a drug. It should be noticed, or sorry, it should be noted that there are many ways a company can try to cheat the system. And after 20 years, they can update the drug. They can add a component. And sometimes these components are just don't make any difference. But then the company says, we get 20 more years because we changed it. So 20 years sometimes turns into more. Another question, and this is a guessing game. I don't expect you to know this. These are like fun facts about medication. How expensive do you think it is on average to develop a new drug? How expensive do you think it is on average to develop a new drug? Hisham says 20M. I'm going to assume that's 20 million. Okay, millions, 100,000s, million. Okay. Give me your best guess. I want to see if someone gets close. 36 billion. Yusra is saying that patents were discussed during COVID because it made it hard to develop the COVID vaccine. Totally. We're going to come, I think our next slide is about the advantages or disadvantages, but that's one of the major disadvantages of patents is scientists are not allowed to share information. So if one company develops a vaccine, that's kind of good, but not great. Another company would love to have access so they can start to improve it. But the first company says, no, we're not going to give you access because it's our technology, is our innovation, it's our creation. So it can prohibit actual scientific advancement. Okay, Iman says 100 to 500 million. Nur Huda saying, by drug, do you mean medicine? Yes, in this context, drug is going to mean medicine or medication. And in many contexts, it can mean medication. But nowadays in English, unless we're having a really clear discussion about medication, like right now, it's very clear. We're talking about pharmacists, pharmacology, medication. So I can use drug comfortably. In another scenario, if it's a general discussion, when you say drug, people think illicit drugs, illegal drugs. And so I always recommend that you say prescription or medication. But here, it's fine. The whole topic is about prescription medicine. All right, let's see what else. Salma says it depends on the type of drugs. Of course, this is just an average. This is not the exact. I'm sure some have been way bigger than the average and some have been way smaller than the average. Yusra says 20K. Hisham says, we never try to develop any drugs for now, miss. Well, actually, think about the COVID vaccine. Pharmaceutical companies are developing drugs all the time. But it takes so long for them to come out that we often don't hear about it. So it costs approximately 5 billion US dollars to develop a new drug from the beginning all the way to it arriving to the market. So this is the logic for the patent system. It costs so much money to develop a new drug. No one would ever do it. No one would agree to do it unless they saw that they would have a big payday, a lot of money at the end. Okay, next question. How many years do you think it takes to develop a new drug from scratch? From scratch means from zero. Develop a drug from zero. So you have nothing. How many years? We know how much money it costs on average, 5 billion. Now I want on average how many years? Okay, Ferdiel says 20 years, Iman 5 years, Hussein 7 years, Hisham 25 years. I'll wait till I get all my guesses. If you want to guess, get your guess in now before I show the answer. 2 years. All right. So we have 15. I think Ferial is the closest. Oh, and Iman says 10. So right between Ferial and Iman, it takes about 15 years to develop a new drug, to go through all the trials, all the data, pushing it through for approval, because governments have to approve new drugs before they allow them to be sold to citizens. So 15 years of development for a cost of $5 billion. Okay, this is maybe a hard question to answer, especially if patents are a newer concept. But I wanted to ask you, what do you think? How do you think patents affect you as a patient? Why does this matter to us? Yeah, got it. Prices. Yeah, patents are connected to prices, high prices. Go ahead, continue. Once there's no, I see you said concurrence. In English, we say competition. Once there's no competition, then what? Yeah, we've seen less choices. Exactly. We face something called a monopolistic situation. Great. Yeah, you got the nose on the button. That means you got it exactly right. And Iman saying availability. Yeah, well, if one person supplies the drug, they get to decide how available it is and they get to set the prices. So I put a really basic sentence, but Ferial, I love the description because it's about exactly the same thing, which is that patents and the companies, of course, that use patents can keep prices artificially high. If there's no one else who can sell the drug, you can say, you know what? This pill will cost $300 a bottle. Because why not? Because I'm allowed to be the only one selling it. And so that's one of the reasons that companies will fight so hard to keep the patent after 20 years. Because as soon as more people start selling, the price is going to fall. In fact, plummet, which means fall really, really far and really, really quickly. What is the opposite of a patent drug? When these new medications enter the market, what are they called? Aha, Selma, it's like you knew my question. What about generics? She says, generic. Yeah, a generic drug or a generic. So these are essentially copied drugs where they see what the original inventor created and they copy it with the same percentage of ingredients, and then they can sell it under a different brand name. There's nothing wrong with a generic drug. It's literally the exact same drug, just a different brand name, but you're not allowed to have generics until the patent has expired. All right, I think, let's see if I have 2 activities or 1 activity left. Okay, I have 2 left, but we're just gonna do 1, I think. So let's read, before we finish, let's read a medication label. So this is like the label that you'll find on the back of a prescription. You'll see it on the left. So we're at a pharmacy that's called Manhattan Pharmacy. We are in New York, New York. We have something here that says RX, RX 123456. And if you look to the right, I have a note for you. RX is an abbreviation that we use to mean prescription. If you say to me, Ariella, why does RX mean prescription? I will tell you, I don't know. I have absolutely no idea. I don't know where it came from, but it is universal. RX, written like this, capital R, little x, means prescription. So what you're looking at on the left side is actually a prescription number. So it's the number of that prescription, even though it just says 1, 2, 3, 4, 5, 6. Usually it would say something like 001175, a tracking number. Then we have the name of the doctor, Dr. Evan Black. And then big and bold is the name of the patient. So this patient is Miss Eleanor Jones. And she's being instructed to take 1 capsule meaning 1 pill, 3x per day. You can see in my notes that I'm also telling you what X means, although I think this one is probably something you've seen. So X means times, talking about the frequency, how often. Take it 3 times per day with food. So not on an empty stomach. Wait till you're eating, take it in the middle, keep eating. Then It actually even clarifies further. Do not take on an empty stomach. Do not take, okay? So you have to have food in your stomach before you take the medicine. May cause drowsiness and upset stomach. Drive with caution. What does what are these? Drowsiness and upset stomach. What's the word we just learned for what these are? Side effects. Thank you, Hussein. These are the potential side effects. Why do we know that they are potential side effects and not definite side effects? What word tells us it's possible that these side effects will exist? May. Thank you, Yusra. It may cause. Absolutely, Hussein. It depends on the individual. Good. And that's why in the medication label, it says may cause, not will cause. Will cause means everyone will have it. And generally speaking, side effects are always personalized. So it's rare that everyone has the same side effect. So almost always on the label, you'll see this word may or might. Okay, and so this medication, now we have the name of the medication, which is amoxicillin. Who knows amoxicillin? What type of medication is this? Nobody? Antibiotics. Absolutely. This is a prescription for antibiotics. Good. We have 500 mg, milligram capsule. So each capsule has 500 milligrams. Then we have QTY. This is an abbreviation for the word quantity. Quantity 15. So in the pill bottle, there are 15 capsules. May refill 1x one time before this date. Use before this date. Okay. What does it mean, may refill one time? What are they saying? Why not 2 times? Why not 3 times? What's the big deal here? How do refills work at a pharmacy? Okay, Hisham says maybe because it's a strong medicine. Okay. But explain to me refills. Why can't I just go and refill my bottle anytime I want to? Fairdale says because it's a prescribed drug. Yeah. Anyone else want to add? It's not over the counter. Very good. Almost. I see of the counter, over the counter. Hisham says because it's empty. Okay. So what I'm thinking is, prescription drugs are required to have a doctor's approval. And so you need to see a doctor to get your prescription. And the medication label makes it clear that, okay, if you run out and you still have symptoms, you don't have to go to the doctor yet. You can get a refill from the pharmacist. But if after the refill, because it says only one time, if after the refill you are still sick, you cannot get a second refill. You have to see the doctor again. So the refill rules are a way of mandating that the patient stays in touch with the doctor if symptoms persist. Okay. So the next activity is going to be too long, and I think we're just going to end here. This was a very fun class. I enjoyed talking about patents. It was fun for me. I hope it was fun for you. Our next vocabulary is all about mental health. So that's also for me going to be a super interesting topic. I love talking about this topic. I love teaching the terminology that we use. Before we end, I'll just show you quickly again the schedule so we can see, because we have 2 classes left. Here it is. So you can see the schedule. So we have just finished session 4, prescription writing and medication management. Next week is vocabulary for mental health and patient care. And session 6 is all about conferences. So we have 2 weeks left, folks. I look forward to seeing you, since I don't see you. I look forward to reading your chats in future conversations. Thank you for your participation. This recording will be on YouTube for those who want to watch it further, and I hope you have a wonderful evening. Good night, everyone.